everyone. Welcome. Thank you for all being here with us for our inaugural podcast. My name is Frank Tucci, and I'm representing RDS Automotive Group. And we are here with Dr. Stephen Klasko, MD, MBA, CEO, and the first president of both Thomas Jefferson University and Thomas Jefferson Health Systems. Thank you for being here.
Oh, it's great to be here. I'm surrounded by amazing cars. You can always get me out here if you're going to put me next to a McLaren.
Well, thank you. And as we take off on this maiden voyage podcast, I do have a couple questions for you.
Sure.
So, Doctor, we read your first book, not your first book, but we read your latest book, Bless This Mess. And I was wondering what has changed in healthcare since you wrote your first book on the subject?
So I wrote my first book in the year 1999. It was called The Phantom Stethoscope, a field manual for an optimistic future in medicine. It was using a history of the future approach of what will be obvious 10 years from now and doing it today. Sadly, unlike every other aspect in our world, in your world, that's changed since the year 2000, healthcare really hasn't. I mean, just think about this, the pre-iPhone era, and whether it's shopping or travel or anything you've done, the amazing changes that have happened,
right?
Except in how healthcare is delivered. I mean, the clinical advances have been incredible. So we have a Star Wars clinical mentality in a Fred Flintstone delivery system. And there's so many people to blame. We can start with patients because patients accept things in healthcare that you wouldn't accept anyplace else. Right. Think about this. You know, if you walked into RDS and you had an appointment at 8 o'clock,
yes,
and your McLaren doctor came in at 8:45, you'd leave.
Right.
But if your doctor comes at 8:45, you're just assuming he or she must have had an emergency. That might be true about 10% of the time. The other 90% of the time, he or she might have just stayed at breakfast. Why? Because every time they come in late, patients say, that's okay. And same thing with technology, right? Think about banking. You don't get up in the morning and say, I'm going to telebank this morning. It's just that 10 years ago, 90% of your banking was done at a bank. Now 90% of your banking is done at home. You don't even know where your bank is. So what we're doing at Jefferson and what I'm excited about is that we're taking sort of a, if you remember the movie Network, I'm mad as hell and I'm not going to take it anymore approach. And we're saying we're going to be the first healthcare system in the country that looks at healthcare with no address. I want you to come to a Jefferson doctor or Jefferson facility because of our care and caring. I don't even want you to know where Jefferson is. That's only, God forbid, if you have to come to our hospital. And I think that's what will differentiate us in this region. And that's why when I write my next book, I will have a lot of things about the American healthcare system to be proud of from a science fiction point of view.
By the way, you can pick up this book on Amazon, Barnes & Noble, or Lulu.
Yep, thank you for that.
It's out now. Well, I think that's phenomenal. And my next question was going to be actually, what could be the most significant change in healthcare and specifically in population health, right? So how do we get people to access Jefferson without going to the hospital?
Yeah. Well, I think we have to start out with, I mean, you know, we have to look at health policy. So if you look at the Affordable Care Act, you know, there's all this political turmoil. But if you look at the Affordable Care Act and you want a non-political statement, which is hard nowadays, the Affordable Care Act did exactly what we asked it to do. It gave a lot more people access to a fundamentally broken, fragmented, expensive, inequitable, and occasionally unsafe healthcare delivery system, and then hoped that we would transform. But it didn't do the things that would have to happen to get us to transform, right? So we have $1 to pay for $1.25 worth of healthcare. I mean, that's probably the simplest way to look at it. And the Democrats haven't wanted to do the hard things that would have to change around population health and how we pay pharma and insurers. So they say, let's give everybody a quarter. Republicans haven't wanted to do the hard things. And they said, but we also don't just give out money, so we'll cut 20% of the people out. So in order to really care for the population, the first thing that has to happen is we have to change the way that we pay people. There's a great Upton Sinclair quote. It's hard to get somebody to do something when their salary depends upon them not doing it. So if you're still paying doctors for doing lots more stuff in the hospital, and they say, oh, we want you to think about the population, that's not going to happen. If you're still paying dermatologists $2,000 to cut out a zit on your face, but paying a neurologist $150 to spend an hour diagnosing your Parkinson's disease, that's not going to create a population health model. If you're going to ask family physicians and nurse practitioners to be the quarterback of the system, but then pay them like the kicker, that's not going to happen either. So our model, and what I espouse in my book, is that we start to look at a model around access, quality, patient experience, and cost, where we negotiate with pharma, where we recognize that insurers have to do more than just be the middleman between the doctor and the patient, where we start to look at things like end-of-life issues, where there's a 10 times difference between how different hospitals in different countries handle it, that we look at how we pay doctors, that we give nurses and physician assistants and other practitioners really the full scope of their ability to practice, and we get away from the guild mentality. And then finally, that we do what we do with pilots, that we assess the technical and teamwork competence on an ongoing basis. I'm a pilot. Every 2 years I have to get my technical competence assessed, but it's been 35 years since anybody assessed my surgical competence.
Wow. And I read that in the book.
Yeah.
And
but don't worry, anybody that's getting operated on me, I'm really good.
Right. Well, so that brings me to the next question, which is about artificial intelligence and humans and robots, and how you say we're bringing more and more people into the medical field that are simply just memorizing, and they don't have that human effect, right? So how do we change that?
Yeah, so I think the first thing we have to get I think words are important, and never use the word artificial intelligence, because you're always going to need humans. So it's really, what we like to talk about at Jefferson is augmented intelligence, deep learning, and machine cognition. And what that means is that robots will be a reality, and robots will augment and help, in some cases, be smarter than the doctors and nurses in the current system. Jack Ma, the CEO of Alibaba at last year's World Economic Forum, had a great quote. He said, when we created cars, we didn't try to get humans to run faster. When we made planes, we didn't try to get humans to fly. Computers will always be smarter than physicians and nurses, but they'll never be as wise. Now, here's why it matters. We haven't changed the way we fundamentally select and educate physicians for 50 years. The gateway, if any of you out there listening to this have sons or daughters or friends that are applying to medical school, the gateway is organic chemistry, right? It's like the NFL Combine.
Right.
You run a 5.1 40, you're not getting into the NFL. Right. You get a C in organic chemistry, it doesn't matter what kind of individual you are, you're not getting into medical school. The final for organic chemistry is taking this complicated enzymatic cycle called the Krebs cycle, having you memorize it, and then giving you a black piece of paper and filling it out. Now think about that for a second. That's exactly who you want for your psychiatrist or family doc, is somebody that can memorize that and fill out a piece of paper. Now that all made sense in the 70s when I went to medical school, because if I could memorize 19 reasons you had a headache, mm-hmm. and the doctor across the street could only memorize 15, I was a better doctor than you.
Right.
But now the 19, like the Krebs cycle, are on my supersized iPhone. And pretty soon there'll be a robot, I'm an obstetrician, that will take a picture of the baby and tell me exactly what's wrong with that baby.
Right.
But here's the thing. That robot, he, she, or it, will never have the compassion, the self-awareness, and the empathy. So it's sort of a no-brainer. We need to select and educate physicians and nurses to be better humans, mm-hmm. not to be better robots than the robots. I didn't mind that we created physicians to be robots because we didn't have robots. But in 2 or 3 years, we're going to have robots. And we're never going to be as good as them.
Right.
So we need to almost 180 degrees change. And that's what we're doing at Jefferson, looking at holistic admissions and diversity, so that we're choosing physicians who are self-aware, empathetic, culturally competent, can communicate well, and work well with robots.
And that relates directly to the automobile industry as well. And being in Philadelphia, I want to ask you about the healthcare state in Philadelphia and the social strata of Philadelphia, how the soda tax impacted things. Are you seeing, this new vegan fad, call it what you want, but is that impacting healthcare at all? Are you seeing that help?
So that's a lot of questions, but,
Right.
but let me try to summarize it. I think that I would say Philadelphia has the best and worst of healthcare in this country. It's got the best because everybody talks about meds and eds, and you have places like University of Pennsylvania and Jefferson, Temple and Drexel and Cooper and Philadelphia College of Osteopathic Medicine. So we have a huge concentration that if you go into a hospital, you're probably going to get good care. So you say, wow, you must have a great healthcare system.
Right.
You'd be wrong. Because if you look at Philadelphia, we have the greatest discrepancy in life expectancy in the country based on zip code. So let me tell you a real story. Jefferson was the official health system for the Democratic National Convention back in 2016. And Hillary Clinton said something about how great it is to be in Philadelphia because of the great healthcare entities. Mentioned Penn, mentioned Jefferson. And I said, yeah, boy, we are good, And then the next day in the New York Times, in Philadelphia, your zip code is more important than your genetic code. Here's a fact. A baby born at Jefferson today that goes to 19147, which is Society Hill, will live to 2104. A baby born at Jefferson today that goes to North Strawberry Mansion, 8.2 miles away, will not make it to 2090. That's a year less than Iraq and Syria.
And this is the 20-year gap you
This is a
talk about,
20-year
right?
gap, and so I would say, and it'll hit your other questions. There's 3 or 4 problems with why that is. One is we never talk to each other. So the simple fact is that while we have Penn and Jefferson and Temple and Drexel and all those others, the chances of the presidents actually talking to each other, unless they bump into each other on the street, are pretty much zero. And it's partly, frankly, a governance problem. What I have challenged the chairs of the board of each of the nonprofit institutions in the provider side or the Independence Blue Cross side is that 25% of the CEO's incentives ought to be how Philadelphia is doing, not just does their hospital have a bigger MRI than the competing hospital. Our board did that.
Wow.
But if every board did that, I guarantee you that the 6 or 7 CEOs would get together and say, hey, what are we going to do? We created at Jefferson the Philadelphia Collaboration for Health Equities. In our gala, when we raised $1 million, we didn't get it to get a new proton beam or a new MRI. We did it to create the Philadelphia Collaboration Health Equities. So that's one. The second is, and this speaks to the soda tax and the vegan thing, the problem with the vegan movement is that most of the people that are doing that are pretty well
They're
off,
already healthy.
going to Whole Foods and saying, I'm going to be vegan. And,
Right.
I would argue that some of them are really serious about it. Some of them are vegan and gluten-free. And then, going out to the bar and having, 12, whatever, but the problem is that that's not going to fix the disparities. In places that are underserved, there's not a Whole Foods. There's a bodega that sells Doritos and soda. And, so I think the concept of if Jeff Bezos really wants to do something, creating almost an Instacart mentality where you can use electronic food stamps and maybe have some subsidized ability to get Whole Foods type food. Because here's a newsflash. Everybody wants their family to be healthy. So, if people are not giving their family healthy foods and kids are more obese in these underserved areas, it's not because those moms wake up and say, I don't care. It's because they might not have enough money for gas in the car to go someplace other than the bodega in the corner, or certainly enough money to go to a Whole Foods type thing. So anything we can do to look at how we can get nutrition, which is probably the most important thing, nutrition, environmental, and public health factors. We spend 85% of our dollars in Philadelphia on what will have 10% of an impact, We spent the 85% on hospitals and acute care, which has 10% on the impact of population. And then I think what I'd say about the soda tax, probably a good start. I think, though, that my argument would be it's a victory lap for something that's spitting in the ocean to increase the tide. At the end of the day, rich people in Philadelphia will go, if they want sodas, and go to Cherry Hill. It's no different than what happened with State stores. You know, there's nobody I know that goes to the State store.
Right.
Because it's like, other than Utah, we're the only place in the country that does that.
Right.
So they go to Cherry Hill
Right.
in their nice cars.
Yeah.
Not as rich folks are stuck having to do that in Philadelphia. So it's probably made an impact to some effect. I'm not sure that everybody stops drinking soda because of that. I think that probably some poorer people did because of the huge price difference. But remember, some of that also includes the diet stuff and even some of the waters that are made by that. So, you know, it's a start, as long as it's not the city saying, "Oh, we've solved the population health problem by doing a soda tax."
Right. Right. That's interesting. Well, as a man of science and arguably one of the most influential and knowledgeable men in the Delaware Valley.
Are you trying to sell me something? Because this is a car dealership after all. The Stanislaw taught you well.
He did. Always be selling.
Yeah.
So I want to know what you drive. What do you like to drive?
This might surprise you, but I drive a 1968 404 barrel.
You did dig this
GTO.
up.
Yes, and
This is,
so you know.
so I heard this is how you used to look.
Well, not only yes. That was in 1975. My first car was exactly the car I have today, a yellow. And by the way, this
Still
is
have
a
it.
little hint. Well, no, I got the exact same thing, totally restored. But if you ever get a restored GTO and it's yellow, and it's bright yellow, it's not a restored GTO. The yellow on the 68 GTO is this amazingly beautiful sort of palish yellow. Anyhow, I have a totally restored carburetor. I have to use aviation premium leaded fuel, 404 barrel GTO. That is my car, my only car.
Your only car.
And as soon as RDS can come up with as cool a car as that, then I'd consider upgrading to something. Say 32, 40.
Perhaps the 570 Spider.
Oh wow, yeah, that's pretty cool, and that's a pretty funky color. You know, so this blue color, it reminds me of those of the blue popsicles that you used to get that I never knew what flavor it was, but they were always the coolest color. Like every other one, the flavor made sense. It was cherry,
right,
lemon,
orange,
and this was just what flavor is blue.
Right. Yeah.
Well, that's not a flavor.
Well, it's like the Gatorade.
Yeah, exactly.
You call it by its color. So.
Yeah. So this is pretty cool.
And if I may, your laptop.
Yes, my laptop is a volcano orange laptop. With actually my phone, which is over there, actually has the black stripe.
To match the McLaren orange.
Yes, exactly.
Right.
It's
so
exactly.
Maybe that's in your near future.
It could be if we can work out the right situation. You know, we could trade for a couple deliveries, or
hey,
if any of you are having babies anytime soon, we can give you the premium package.
You never know. Well, Dr. Klasko, it's been a complete pleasure. And I would like to thank you for being here with us on our first podcast. And thank you for coming.
Well, it's great. And it's, I just have to tell you, I mean, it's just so cool to see American technology, United Kingdom technology, European technology, all coming together. And if we can do for healthcare what you represent has done for the automotive industry, then we'll be in good shape, and I'll be able to stop writing books.
I think you can. Thank you.
Sure.